Hi, my name is Tina Andrews, and I'm with the Parent Information Center of Delaware. Today, we are going to talk with you about pregnancy and postpartum exercise and nutrition. This is the third in our series of pregnancy and postpartum webinars. The next one we have in 2 weeks will be on COVID-19 and birthing options, and they happen on Wednesdays, Thursdays, or Fridays, so please check out our calendar at pickofdel.org. Today, we are coming to you from the Parent Information Center. We have a community doula program, and our mission includes advancing effective parent engagement in education and for all children to fulfill their potential to succeed. We understand how to support parents and families. We have been doing it for 36 years. And have worked with 90,000 plus families, and decided that part of our mission is also working with families that are pregnant, parenting, families from conception to when their children go off into career, college, whatever is next for them. So we think prenatal support and postpartum support is very important for a number of reasons, including it improves childbirth outcomes, reduces the rates of cesarean deliveries, prematurity, and illness, also improves the overall satisfaction with the experience of childcare and breastfeeding. Postpartum support decreases fatigue, tiredness, and pain. Again, increases the rate of breastfeeding, initiation, and longevity, improves parent-child attachment and bonding, decreases postpartum depression, loneliness, and anxiety, and increases parent advocacy, which is a very important part of this process as well. There are many communities that are seeing higher maternal and infant mortality rates, communities of color, low-income communities, all kinds of different families. And so it is important that we also talk about advocacy for those families and work to make sure that mothers, birthing people, and infants are not dying. So we're going to talk briefly about exercise. Always consult your doctor before starting any exercise or nutrition program and during exercise and nutrition programs. The types of exercise that are recommended for pregnant women is walking, swimming, yoga, but not hot yoga, and strength training. And the recommendations from the March of Dimes and other organizations is about 2.5 hours a week, and that is spread out over the week, not necessarily all in one go. The benefits of this during pregnancy are to manage stress, to sleep better, to reduce pregnancy complications such as diabetes and preeclampsia, and to help with discomfort such as back pain and muscle aches, cramps, etc. During pregnancy, nutrition is also critically important during pregnancy and postpartum. So during pregnancy, you should increase your calorie intake. Also, it's important to learn about and understand the interaction of your developing child, fetus, and folic acid, calcium, and have an increase in fiber and fluids. Postpartum, there's a recommendation for more iron-rich foods and omega-3 fatty acids. We are honored to have Chang Yi from WIC Education Specialist from the Food Bank of Delaware here to talk about what does that look like, and what are some recipes, and what are some ways that WIC and the Food Bank support women and birthing people in this period of their life.
All right. And thank you, Christina, for that introduction. As she said, my name is Chong Yi, and I am a WIC education specialist with the Food Bank of Delaware. Today, I'm going to be talking about the WIC program, some changes due to COVID-19, and kind of the process of how WIC is doing their appointments. And then afterwards, I'll do a short little demonstration on a recipe that utilizes some of the items that you would get in a WIC food package. And I'll talk about the benefits of some of the nutritional components of those recipes. So the WIC program stands for Special Supplemental Nutrition Program for Women's Infants and Children, otherwise short for WIC, because that is a mouthful. This is just an overview of some of the things I'll be talking about. We'll be going over the program, some background information. I'll talk about the eligibility for the WIC program, some reminders and updates, and then the WIC food package, and then some COVID temporary additions to the food package. And then I'll mention a little bit about the WIC mobile app, and then what we do with the partnership with the WIC program and the food bank. So just some background on WIC. So in 2017, the estimated number of people eligible for WIC was around 14 million. And that overall WIC coverage rate was generally increasing between the years of 2005 and 2011. But then since 2011, the overall coverage rate has generally been declining, and it sits at just over a little over 51% as of 2017. So the coverage rate has been declining across all the demographic groups eligible for WIC, which I'll kind of go into the next few slides. And then among children, the coverage rates for children that are older than 1 typically have the lowest rates. And then looking at the study, 4-year-olds typically have the lowest coverage rate out of all the demographic groups. And then for Delaware specifically, the coverage rate in 2017 was sitting around 43.4% of the eligible population for WIC. So that was a little bit less than half than the eligible rate. I know with COVID, they've seen a little bit of an increase because of the convenience of the appointments, but I'll get into that a little bit when we talk about the process and the appointments for WIC currently. So just to kind of go over some barriers to WIC participation, just to kind of give you a scope of maybe why some families are not participating in WIC. One of them is misconceptions about who is or who is not eligible. And one of the things I wanted to point out was for immigrant families, WIC is not a public charge. So I know that was one of the biggest things about applying for WIC was the citizenship status, but WIC will not ask you for that. So those immigrant families, they don't have to worry about being asked about their immigrant status. And then for the other ones, transportation, I know, especially down in Kent and Sussex counties, the clinics are a little bit further from where, some of the eligible populations where they live. So transportation might be a barrier. I know we have some pockets of non-English speakers that may have some language and cultural barriers when it comes to the clinic experience. Some of them, in the clinics prior to COVID, maybe some of the longer wait times and then maybe poor customer service could have impacted their participation to WIC. And then some of the other items would be, taking time off of work to go to appointments, especially, if you have children at that age and you're taking them to doctor's appointments, and then on top of that, you're taking them to WIC clinic appointments. That could be a lot, especially if they're working and they have to take time off to take children to these appointments. And the other one was dissatisfaction of the food package and what they were receiving, and then difficulty in redeeming benefits as far as the embarrassing checkout experience and not being able to get, or not getting the right WIC product, which I'll actually talk about the WIC mobile app a little bit later. That's kind of, I think, remedied that situation. But overall, these are just some of the barriers that WIC families face, and maybe some reasons as to why they may not be participating. So the The demographic eligibility that I talked about earlier, these are some of the demographics that I'll mention as far as who's eligible for WIC. So if you're pregnant, the entire duration of pregnancy, you would be receiving WIC. If you're breastfeeding, up to 12 months postpartum, and you'll get a full food package. And then for non-breastfeeding women or partially breastfeeding women, you'll get food up to 6 months postpartum. And then formula fed infants, they'll get formula for the first 12 months. And then starting at 6 months, they'll start getting baby food added on to their food package. And then breastfed infants, they'll start baby food at 6 months. And of course, that food for mom for those 6 months as well. And then children between the ages of 1 to 5 will receive a full food package through the month of their 5th birthday. So traditionally, when WIC appointments before COVID-19, they would be in person. So the nutritionist would provide nutrition education. Um, and all the appointments, as far as the anthropometrics and everything that they gather, would be done at the WIC offices. However, with the pandemic, WIC offices are currently closed to the public, but WIC services are still available. So all the appointments right now are being done over the phone. So to schedule an appointment, or if you have questions about eligibility, you would call one of these two numbers and talk with the WIC staff. Um, Now, when you do call one of these numbers, they'll give you a prompt on the WIC clinics that are in the area, and then you'll just call the one that you live closest to. And then the other thing is for the nutrition education module. So that was an option for families to complete a nutrition module that related to pregnancy, toddler nutrition. So there's a whole library of different nutrition topics on this smart app that they have. Um, and it's still accessible for families as well to utilize this. And then the last thing is there's free support from breastfeeding peer counselors. So if the mom is breastfeeding, they can ask the nutritionist for a referral to get in touch with a peer counselor. And right now, I believe they're doing Zoom classes as well as one-on-one interaction with breastfeeding peer counselors if they need that support. So, as far as eligibility, I mentioned the categorical demographics in which you would be eligible for WIC. But the four main points as far as eligibility would be: one, they do have to reside in the state of Delaware to receive Delaware WIC. Two would be they would determine their nutritional risk. So this would be determined by the nutritionist during your appointment. And then three would be meeting income guidelines. And then four, meeting one of those demographics that I mentioned earlier. So for income guidelines, if you happen to be on SNAP or any other government assistance programs, you automatically apply, or you automatically are eligible for WIC. So if you are already receiving SNAP, then you would be eligible for WIC, or if you're receiving Medicaid, same thing, you would be eligible for WIC as well. So just some reminders and kind of hitting the key points that I mentioned earlier. So enrollment and continual participation is required with the WIC staff to stay on the WIC program. So depending on, let's say if you just recently applied for WIC, you do need to do continual participation with appointments to follow up to get reloads for your benefit cards, as well as recertifying for whoever is eligible for WIC each year to stay on the program. The participants, what they receive as far as when you apply for WIC, you'll receive a EWIC card, and then benefits are distributed on a monthly basis for up to 3 months at a time. So they usually reload your benefits every 3 months, and then each month those will load on your card every month for that 3 months. The other thing is that parents, step parents, legal guardians, foster parents may apply for their children who qualify for WIC. So it doesn't necessarily have to be, the birth parent that has to apply for WIC. So if someone else has legal guardianship of the child, or maybe say it's a grandparent, if they have a child that's under 5 and they meet all the other requirements, then they can apply for the child for WIC. The other, I think, misconception too is that they don't need to be married to apply for WIC. And then the last thing, as I mentioned earlier about the public charge, they don't need to be a US citizen to receive WIC either. So this is just a overview of the Delaware WIC food package. So this is typically what clients would receive when they receive their EWIC card. They'll also receive this booklet that kind of lets them know what foods that they get. They also get a shopping list of the items that are on their benefits. So just quickly, I'll just kind of go through some of the foods. So as you can see on the left side here, there's cereal, both child and adult brands that are listed here. On the top here to the right, there's yogurt. Um, I'll talk a little bit about the COVID temporary changes on the next slide after the food package, but there's yogurt listed on here. And then as far as fresh fruits and vegetables, they can get any variety of the fresh bulk fruits and vegetables. They can get bagged ones or those in containers. It just has to be without the dressings or the dips or anything like that. It just has to be the fruit. And they can also buy organic. For Delaware WIC, though, frozen, canned, or dried fruit is not available on the WIC food package. It does have to be fresh produce. And then on the left side here, as I mentioned, infants who are either on formula or being breastfed, they'll start baby foods at 6 months. And then these are the foods that they'll be getting. So they'll have the infant cereal, the infant vegetables, the fruits, and the meat. And then moving over to the milk, they can get the fresh whole milk, 1% or skim. So depending on what category that they fall under WIC will depend on what milk that they get. I know with COVID, they kind of changed this a little bit. And typically 2% was not part of the WIC food package, but because of COVID, they did add that as an option because they knew that milk was one of those things that was not as available, especially at the very beginning of the pandemic. So they added 2% as an option. And then peanut butter, they can either get the creamy or the crunchy kind in either the 16 or 18-ounce jars. And most of the items on the food package are usually the store or store designated brands in the foods. And then the next one would be dried beans. So 1 pound of any dried beans and any variety of that as well. So it could be split peas, lentils, and any variety of beans as well. Next, we have bread and tortillas. They can get 100% whole wheat or the whole wheat tortillas. So they have the option to pick one or the other. And then if they are breastfeeding, if they're exclusively breastfeeding, they get canned fish as part of their food package as well. And then as for juices, this would be part of the children's food package. So right now, most of them are the apple juices, but they did add a couple of the different fruit juices, 100% fruit juices as well. And then as far as eggs, is a large dozen white eggs for the food package there. And then for cheeses, it's either the cheddar or mozzarella or the pasteurized processed American cheese that they can get in either the 1 pound or 16-ounce packages. And then as far as the concentrate, that would be for the pregnant women food package. They could get one of the varieties of the frozen concentrates. Now, as far as some of the changes to COVID, as the food package goes, at the very beginning, grocery stores were limited in what they were carrying. A lot of WIC participants weren't able to redeem some of the foods that were on their WIC benefits because of shortages in those grocery stores. So they did expand the food package a bit just to allow for different variety of things that they could redeem. So I mentioned earlier with breakfast cereal, so they can get up to any package size up to 36 ounces for the cereals. For eggs, they did add another brand for Eggland's Best is now allowable on WIC. And then as far as milk, as I mentioned before, 2% was an added option. And then the brand Organic Horizon Milk was also an allowable addition. And then as far as juices, any mixed 100% fruit juices are now available. In reference to dried beans and peanut butter, they just added some another brand of peanut butter to that list. And then for cheeses, instead of just the block or the sliced cheese, they can get shredded and individually wrapped cheeses of any size. That's 8 or 16 ounce as well. And then as for yogurt, before it was just the plain yogurts, but they did expand that to allow for Greek yogurts. And these are the listed brands that they can redeem. And then for baby foods, they added the organic fruits and organic vegetables for baby foods as an option. And then lastly, for whole grains, as I mentioned earlier, you could get whole wheat bread or whole wheat tortillas. They did add brown rice and whole wheat pastas as an option for that as well. So these are just some of the temporary changes that they added because of the strain that the grocery industry was causing, that I had at the very beginning of the pandemic. So to reduce kind of the impact of the limited items in the grocery stores, they did expand some of the items that clients are able to redeem on their WIC food package. So lastly, I'll kind of mention what WIC outreach is and education. So as I mentioned, I'm a WIC education specialist with the Food Bank of Delaware. So we have a partnership with the Delaware WIC program to do outreach and education in the community to raise awareness about the WIC program, to provide nutrition education, some fun cooking demonstrations, and we give information to community groups, childcare centers, early Head Starts regarding WIC enrollment and benefits. And then after this, actually, I'll be doing a short food demonstration that highlights foods that are a part of the WIC food package. And then we also have preschool curriculums that are also available for centers that would like to teach that in their centers. And then lastly, I wanted to mention nutrition materials are always available on our website. So if families would like to access any recipes or videos or have links to videos, that can be found on this link here at the bottom. And then I did want to mention really quickly about the WIC mobile app. I'll go ahead and switch my screen so you can see the app. So this is the Delaware WIC mobile app that was, I believe, released in the summer of last year. So this WIC mobile app makes it really easy for participants to view their benefits, view their upcoming appointments. The one thing I also wanted to mention is that they have the option on this app to scan the UPC codes at the grocery stores. So in order to see if the item is WIC eligible or not, they can just quickly use their phone to scan the barcode at the in the grocery aisle to see if that item is WIC eligible. And I think that'll kind of reduce some of the checkout process for clients, and they may not be sure if it's WIC eligible or not. And then they'll receive some appointment and benefit alerts on their app, as well as be able to see which grocery stores are accepting WIC throughout the state, as well as the clinic locations and information throughout the state as well. So this is the app to the right here. The card in the middle is the Delaware eWIC card, and that's where their benefits are. And that's what they receive when they sign up for WIC. And then as you can see on the bottom here, you can see the little tabs on what they will be able to access. So once they sign up for WIC, they'll receive their unique ID and then sign up on the app. And then they'll be able to access a lot of that information through this app here. And the app is available both in English and Spanish.
Good. Can I ask a question? So if I am a newly pregnant person, why do you feel like WIC is important and for that person and their child? What is the benefit for them of doing this? Because I know at first it might seem like a daunting kind of process. What have you seen, and and what support do you guys give families that are new to this that might not have received food benefits before?
So I think for the WIC program in general, it's a great program for pregnant women, for children, for those that are breastfeeding. It provides a well-rounded food package for them, especially for those stages where they're either growing a baby or taking care of one. The food package is specifically tailored to meet the needs of nutrition during pregnancy, toddler nutrition, as we mentioned, some of the vitamins and minerals earlier, like folic acid, calcium, iron. So those are especially important during the stages of pregnancy and child nutrition. And the food package does a good job of kind of providing those extra foods that, those populations may need, as well as in the appointments. I see that a lot of times the families make connections with the nutrition staff and the WIC staff in general. Any referrals that they may need, they usually have, and they can refer them to any services that they are requesting. So it's a well-rounded experience, I think, for the families, not only creating a relationship with the WIC staff and, either creating that relationship during the pregnancy stage, but also, when the child is born, and then for them to stay on the program. They also give some information on nutrition education as well during the appointments. So it's a well-rounded experience as far as, outside of just the doctor visits, you have somebody else that can check in on you, as well as give some available resources in the community as well. And they do a really good job of referring, clients to outside services if needed, and they kind of identify that during their appointments and things like that. So
Well, the WIC office would follow the child through those 5 years. And are there like requirements for the child to be seen? I know it might look different now with COVID, but you know, does the parent have to bring the child? What are the requirements around that?
So, if the child is on WIC, so whoever is bringing them to the appointments, they would just need to provide the information as far as who's on the program. Most of the times, whoever's either taking care of them or the one that signed them up for WIC is usually with them for those appointments. And they do when they were doing in-person appointments, they would still take anthropometrics, making sure that um, they were okay on the growth chart, because they look at all that information as well when they come in for their appointments. And then they kind of just ask about the overall well-being of the child, as also maybe the person who's taking care of them as well. But yeah, they do follow them throughout the fifth birthday if they recertify every year. Like I said, continual participation and appointments are required to stay on the WIC program. So as long as they're willing to, recertify and stay on the program, then the child can be on WIC from birth to 5 if they still qualify with all of those measures that I mentioned earlier.
And if a family maybe doesn't know much about food and nutrition, you do provide some tips about what to cook, how to use the food, and how to get started.
Yeah, so like I said, with our partnership with WIC, we do provide that other side of like the education, if maybe more of an elaborate lesson, or maybe more of a fun way to kind of showcase nutrition, and also a way for families to also participate sometimes in the cooking demonstrations, as we are doing things virtually right now. It provides that opportunity for families to maybe cook along at home, and learn about some of the items that they're purchasing with WIC benefits, and the nutritional components of why those are important or why they're part of the food package. And it kind of makes the connection as to, oh, this is what I'm receiving, but this is also the nutritional benefit for me and my kids. So we kind of provide that nutrition aspect on that side. And like I said, make it fun, either through a food demonstration, or if we do a nutrition lesson, we always try to keep it engaging and fun for the families to participate in.
And then you have a relationship, you have a partnership, the food bank. So your families also are able and encouraged to use the food bank if they need it.
Yeah, so if families do need additional food, we do have pantries on site in both Newark and Milford. We have two locations for the food bank. So if they do need food assistance, they can always come to the food bank. We do have a drive-through process currently for our pantries. So if families are looking to get food, they would just need to bring identification that shows that they live in Delaware, or a photo ID and a piece of mail that identifies them being in Delaware to receive the food. So yeah, if families are in need of food, they can always come to the food bank. Our Healthy Pantry Center is open Monday through Friday. And then depending on if it's Newark or Milford, most likely Milford, our pantries are open a little bit later on the fourth Thursdays. So they're open until about 6:30. So to kind of accommodate maybe some of the parents that are working, until 4 or 5 o'clock in the evening, they can come by the food bank then to access the food pantry that we have on site.
That's awesome. And you're going to give us a demonstration?
Yeah, so I'm actually gonna set up just a couple of minutes. So if you just give me a couple minutes to set that area up, and then I'll be back in a minute.
So while we are waiting, while she sets up, I do want to talk about where you can access more information. Right now, we are interviewing for our community doula program, which will be in Seaford. It is open for residents of Sussex, Kent County, to serve the Seaford area and the larger community of Sussex County. So if you have interest in becoming a doula and or birth work, please feel free to give us a call or an email, or check out our website at pickofdel.org. We also have a weekly e-news that goes out throughout the week. We have our general one, as well as one that supports transition and early childhood, one in Spanish as well. And we have Facebook pages for our Spanish speaking families, our Parent Information Center of Delaware one, and our newest one is for our Haitian families throughout the state. So please check us out. We also have a video portal where you can find this webinar in about a week with closed captioning, and a whole plethora of other webinars and videos about topics ranging in special education, pregnancy, postpartum, doula, all kinds of different topics. So if you have a question or a concern, go there to our website under resources, and you log in one time, and then you have access to it whenever you need to, whenever a new video is posted. So please feel free to check that out. And thank you so much for viewing this webinar. Please fill out the survey that is sent after the webinar, because that gives us critical information about what you like, how useful this information is for you, and also what topics you would like to see in the future.
Okay, 1 second. I'm just bringing up the recipe so that I can share it on the screen here. So today I'll be demonstrating a chickpea cookie dough recipe. So hopefully you can see the recipe here to the side. Okay, and before I get started, just remember to always wash your hands before beginning any food prep. So I'm gonna wash my hands really quickly. All right, so I'm gonna go over all of the ingredients listed here, what we'll be needing today. So for the ingredients, I have about 1.5 cups of chickpeas. I am using canned chickpeas here, but on WIC, like I mentioned earlier, you can get dried beans. So you can get the dried beans and then just cook this down for a couple of hours, or soak them overnight and then boil them just so it's a little bit faster. And then you'll also need about 1/4 cup of creamy peanut butter. So that's what I have here. And then I'm going to use instant oats here. So about 1/4 cup, or you can use 1 package of the instant oatmeal. And this is also available on the WIC food package as well. You'll need a little bit of baking powder. And then I'm also going to add a little bit of maple syrup and vanilla extract to the cookie dough here. And then the last thing is you can add chocolate chips, obviously, for the cookie dough if you'd like to, or you can leave the chocolate chips out. And then as far as equipment, you'll need to use either a food processor, or if you don't have a food processor, you can use a blender. I find that the blender doesn't work too well sometimes, so you may need to do it in batches instead if you use a blender for this recipe. As far as prep time, it usually takes about 5 minutes for prep, and then total time is anywhere between 15 to 20 minutes. So it's a great recipe to do for a snack if you want to get your toddlers involved and kind of have them help you with mixing items or adding things to the blender or food processor. That's how your kids can help in the kitchen. All right, so I'm going to go ahead and add all of the ingredients to the food processor here and just blend everything up. The only thing you're not going to add is the chocolate chips. You're going to fold these into the batter or the dough once you finish putting in the food processor. All right, so I'm going to go ahead and add all of the chickpeas. Chickpeas are a great source of plant protein. They also have a little bit of fiber, which helps with bowel movement. And then, like I said, since you don't have like a main protein source on the WIC food package, this is one of the, beans are a good source of protein. And then I'm going to go ahead and add the 1 package of the instant oatmeal. So on the WIC food package, you can get the instant oatmeal either in the large container or these individual packs in this box here. The oatmeal is a source of whole grains. So as far as like my plate guidelines, it's good to have at least half of your grains come from whole grains. This is a good source of fiber as well as source of iron. Iron is really important during pregnancy as well as for younger children. And I'm going to go ahead and add some peanut butter. And you'll want to have add about 1/4 cup of peanut butter here. And if you do have kids that are that have nut allergies, you can use a nut substitute like sunflower butter. You can use that in this recipe instead. Or there's like other peanut butter alternatives if you have that as well. All right, and then next I'm going to add a little bit of the baking powder. Now, if you are baking these, this is what the baking powder is for. It kind of helps to give a little bit of rise to the cookies. And as far as the baking powder goes, you'll just need about a 1/4 teaspoon. You can add a little bit of vanilla extract to this. This is optional, you don't have to add the vanilla. And you'll need about a 1/4 or 1/2 teaspoon of vanilla. And then I'm gonna add about a 1/4 cup of the maple syrup to this as well. Now, if you want to, you can use another type of sweetener. I would recommend avoiding honey, especially for children that are under the age of 1. They should not be having honey because of the risk of infant botulism. So you want to avoid honey if you have kids that are under 1. So I usually like to use maple syrup as a sweetener. And then lastly, I'm going to add a little bit of cinnamon to the batter here just to give it a little bit of extra flavor. And you just do like a pinch or dash of cinnamon here. And then I'm going to go ahead and blend this up. You'll want to do this in like 1 to 2 minute intervals. So once you blend it for a little bit, you'll use like a spatula to kind of scrape down the sides and keep blending until it gets smooth. I'm just going to mute myself so you don't hear the blender here. And as you can see here, it's starting to kind of form a dough in the processor. And like I said, you'll just want to scrape down the sides and then keep blending until everything's mixed in. So I'm just going to check that everything's mixed in here. So once everything's incorporated, you should see a cookie dough batter kind of that looks like this. So as you can see, all the parts are mixed in. You can blend this one more time if you'd like. And if you are using a blender, I would say you'd need to blend this a little bit more. So I'm going to go ahead and add the cookie dough to a bowl. And then we'll go ahead and stir in the chocolate chips. And chickpeas are a great option to use because they're pretty mild in flavor, so you won't really taste the chickpeas. And then as far as the chocolate chips, I'm going to use about a 1/3 cup of chocolate chips. And then you'll want to go ahead and just stir that in. Now, if you did want to bake this, so this is the end product here. This is the chickpea cookie dough recipe. If you'd like to bake the cookies, you can set the oven to about 325 degrees and then bake these for about 10 minutes or so. If you want them a little bit chewier, you can cook them for about 8 minutes and then take them out of the oven and let them um, rest for about 5 minutes before taking them off of the baking sheet. And as far as the storage goes, you can put them in an airtight container and you can refrigerate these for up to a week. If you are freezing them, just make sure that you put them in a freezer safe dish or a freezer safe bag, and these can last up to about 3 months. So the cookie dough recipe is safe, especially for pregnant women if they can't have regular cookie dough because of risk of salmonella. You can make this recipe and still enjoy a cookie dough. Um, and this, like I said, is a good recipe for has a lot of protein, some fiber, as well as some iron in this recipe, and then some whole grains as well. So a great snack, or you can make the cookies for a dessert. So hopefully you try this recipe, and I'll also be sending the recipe out as well, so you have this.
Thank you so much. I appreciate you showing us a recipe, taking the time out to do that. And it looked fairly simple and straightforward.
Mm.
Um, and where would families go if they would like more information or if they are looking for other ingredients that they can make?
So the website that I had earlier on this slide here, which I'll actually go back to right now. So they can access our nutrition materials on fbd.org/nutrition education. If they're interested in signing up for virtual cooking demonstrations, we also have a link for that as well, which I can send you. So if families would like to register for classes or demonstrations, that link is available for them to register, and then a Zoom link will be sent out to those that are interested in any of the classes.
Yes, and we are planning at PIC to hopefully have a series of demonstrations for our families in the coming months so that they can get an idea of how to use the food and what would be beneficial for themselves during pregnancy, postpartum, and then for their infants and children as well.
Yep.
All right. Well, thank you so much. I really appreciate you taking out the time to share this with our families. And we will be seeing you soon.
Yep. And then I'll leave my information. So this is my phone number and then email, as well as Alicia Beckford, who is my counterpart in Newcastle County. So I cover Kent and Sussex County, and Alicia covers Newcastle County. But you can reach either one of us and we'll get back with you. So if you have any questions about WIC or would like to shoot me an email, my information is up here. And thank you for having me today.
Yeah. Thank you so much.